All right, guys, question always comes up. Will my job be replaced by a robot? And if you're in nursing, the answer is no. Your job will not be replaced by a robot. Some other industries, yes, it is definitely possible. And I understand that we have robots now delivering medications in hospitals, things like that. These things aren't exactly the newest of things, but they do exist. I remember seeing a robot in the VA when I was doing my clinicals back in sometime around 2012, 2013. So for roughly 10 years or so, robots have sort of been delivering meds and food and things like that in hospitals. However, nursing is a little different, and here is why. In order for a robot to work, you have to set it up some parameters, coding if you will. You have to code that robot to do whatever it needs to do, that one particular task. Now let's just say, for instance, you give that robot the task of giving shots. Just simple flu shots, just right in the top of the arm there, right in the shoulder. You say, you know what, let's make this robot give everybody a shot. No one person has the same arm at all. Every single individual has a different arm from every other individual. And, as sad as it is to say, some individuals don't even have an arm. True, I don't like to talk about it, but that is actually true. People's meat isn't exactly where it should be sometimes, or sometimes sub-Q tissue is in different areas. That robot is going to stick the same spot every time as it is coded to do. It's going to probably take some sort of measurement, say right here in this triangle, boom, that's where the shot goes. Well, the triangle may not be where it needs to be, and a person needs to be there in order to say, you know what, that's not where the shot needs to go. Shots need to go right here. That's just shots, not to mention medication. Things happen in medication. Let's just say that this robot is set out to dispense medication. Let's say it's even a liquid medication, an oral suspension, a liquid. And for whatever reason, air gets in the line, or air gets in the process of how the medication is supposed to be dispensed. The robot is going to think, oh, I just dispensed 500 milligrams or 500 cc's or whatever it may be, whatever the measurement may be. However, if a person sees the air just went in that line, they should know automatically, hey, that's not 500. I need to redo this. A robot is not going to know that. They're going to say 500, job done, and send it out the door, whereas air may be in that. Or mistakes do happen. Someone is going to have to hook up the medications. What if the wrong medication is in that robot? It could also happen. A person needs to be there to sort of quality control these robots in nursing. No one person is different. No wound is the same. No one person is the same. No wound is the same. Every single person is different. And currently, in my opinion, we do not have the technology to fully assess an individual based upon what a robot tells us. We do not have the ability to do this at this moment in time. I myself, I'm in substance abuse. There are times where I have patients who are impaired, and I will do all of these things on paper, and on paper they will look not impaired, simply based on the parameters of the paper. But I can see and can tell and can hear how they sound, and they look and sound impaired. Therefore, tell the doc, hey, you know what, I think it might be time that we do not do what we were going to do, and we do something different with this patient, because I believe that they are impaired at this moment in time. Things happen like that, and a person needs to be there to catch them, and not a robot to catch them. Just my opinion, I don't believe nursing is going anywhere, especially with robots being created more and more and more. Nursing's not going anywhere. We're here to stay. Robots are not going to force us out, at least for the near future. We just don't have the technology to do what a nurse does. I hope it helps. Thank you much.